It's pretty amazing to think about how much medical information we're generating these days. With all the x-rays and CT scans and MRIs, it's just an incredible amount of data.
It really is. It's like a tidal wave of information. And what's really fascinating is that we now have AI stepping in to help us make sense of it all.
Yeah, it's like having a superpowered detective sifting through all those images looking for clues.
Exactly. And that's what we're diving into today, the role of artificial intelligence, specifically machine learning and deep learning, in transforming medical diagnostics.
And what's interesting is that you've gathered this incredible collection of articles that really explore this topic in depth.
I have, and our mission today is to really distill the key takeaways from these articles to give our listeners a clear understanding of how AI is being applied in the field right now and where it might be headed in the future.
So let's jump right in. We talk about this massive amount of medical data, particularly in imaging. What's the core challenge that AI is so well suited to address?
Well, the sheer volume and complexity of medical imaging data is really the crux of the issue. Imagine a radiologist having to examine hundreds, sometimes thousands of images every single day.
Oh, wow. Yeah.
It's an incredibly demanding task. And even with the highest level of expertise, there's always the possibility of human error, overlooking a subtle detail.
Right. Fatigue can set in.
Exactly. AI, on the other hand, has this incredible capacity to process and analyze vast amounts of data with remarkable speed and consistency, and that's where machine learning comes in.
So machine learning is essentially about teaching computers to learn from data, right?
Precisely. It involves algorithms that can identify patterns in data and then use those patterns to make predictions or decisions.
And deep learning takes this a step further.
It does. Deep learning uses artificial neural networks, which are inspired by the structure of the human brain. These networks can learn incredibly complex patterns, often even surpassing human capabilities.
Wow. So AI is not just processing information faster, it's potentially seeing things that we might miss.
That's exactly right. And that has profound implications for medical diagnostics, particularly in imaging.
So let's talk about medical imaging specifically. How does AI learn to detect diseases in images like X-rays or CT scans?
Well, in machine learning, we start by training the algorithms on massive data sets of labeled images, for example, thousands of X-rays that have been carefully examined and labeled by radiologists.
So the AI learns by example.
Exactly. It learns to associate specific visual features with the presence or absence of a particular condition.
And with deep learning, it gets even more sophisticated.
It does. Deep learning allows the AI to automatically extract these features from the raw image data without needing explicit instructions.
So it's not just looking for predefined patterns, it's actually discovering new ones.
That's the amazing part. It's like having an AI research assistant that can identify subtle indicators that might have gone unnoticed by human experts.
So what are some specific examples of how AI is currently being used in medical imaging?
Well, one area is image segmentation, where AI can automatically outline specific structures in an image like organs or tumors.
So it's like a digital highlighter that helps doctors focus on the relevant areas?
Precisely. And then there's direct disease detection, where AI can flag potential abnormalities or areas of concern that might warrant further investigation.
And it can also help with image preprocessing, right? Enhancing the quality of the images to make them clearer.
Absolutely. That can make a huge difference in the accuracy of diagnosis. Yeah. And finally, AI can perform quantitative analysis, measuring and tracking subtle changes in images over time.
That's really valuable for monitoring disease progression or treatment response.
Exactly. And the articles you shared highlight the fact that AI can often detect these subtle changes even before they become visible to the human eye.
That's incredible. The potential for early diagnosis is really exciting.
It is, and it's one of the most promising aspects of AI in healthcare.
Now let's shift our focus to radiology specifically. How is AI being used to assist radiologists in their daily work?
You can think of AI as a highly efficient assistant that can help streamline the workflow and reduce the burden on radiologists.
So it's not about replacing radiologists, but augmenting their capabilities.
Exactly. AI can automate time-consuming tasks, like prioritizing urgent cases or measuring the size of lesions.
It's like having an extra pair of eyes that never gets tired.
Precisely. And it can also serve as a decision support tool, offering a second opinion or highlighting potential areas of concern.
That can be incredibly helpful in complex cases.
It can, and importantly, AI has the potential to reduce what we call inter-observer variability, which is the variation in interpretation between different radiologists.
So it helps ensure more consistent and reliable diagnoses.
Absolutely, and that's crucial for patient care.
Now, you mentioned earlier that AI is being applied across a wide range of imaging modalities. Can you give us some specific examples of where it's shown success in detecting different conditions?
Sure, let's start with X-rays. AI is being used to detect bone fractures with remarkable accuracy, which can be really helpful in emergency room settings.
And in CT scans?
AI is proving to be very effective at identifying lung nodules, which are often an early sign of lung cancer.
That's so important for early detection.
It is, and AI is also being used to assess heart conditions, evaluate internal injuries, and even diagnose various other cancers using CT scans.
Wow. And what about MRI?
Well, MRI is great for visualizing soft tissues, and AI is being used to segment brain tumors, which helps surgeons plan for surgery more precisely.
That's amazing. And it can also help detect neurological conditions, right?
Yes, AI is showing promise in detecting conditions like Alzheimer's disease, multiple sclerosis, spinal cord injuries, and joint diseases using MRI.
And ultrasound.
Ultrasound is often used for real-time imaging, and AI is being applied to assess heart function and detect fatty liver disease.
That's really interesting. And of course, mammography is a crucial area for early cancer detection.
Absolutely. And AI is proving to be very valuable in detecting breast cancer and analyzing subtle asymmetries in breast tissue.
And even in pathology, where tissue samples are examined under a microscope.
AI algorithms can identify cancerous cells and analyze biopsies with impressive accuracy.
That's remarkable. And what about cardiology?
AI is being used to diagnose a range of heart conditions, including coronary artery disease, arrhythmias, heart failure, and even low ejection fraction, which is a measure of how well the heart pumps blood.
It's really incredible how widespread the applications are.
It is, and in ophthalmology, AI is making significant strides in the early detection of diabetic retinopathy, which can lead to blindness if left untreated.
So AI is really touching nearly every aspect of medical imaging.
It is, and the results are incredibly promising. The articles you shared mentioned some really impressive statistics.
Yes, they did. Can you share some of those highlights with us?
Well, in one study using machine learning to classify brain tumors from MRI scans, the AI achieved an accuracy of 98.56%.
That's incredible.
And in another study using deep learning to detect breast cancer metastasis in pathology images, the AI achieved an accuracy of 99%.
Wow, those numbers are really impressive.
They are. And in a study on lung nodule detection using deep learning on CT scans, the AI actually outperformed radiologists, achieving 94% accuracy compared to 65% for the radiologists.
That's really remarkable.
It is. And there's also an autonomous AI system for diabetic retinopathy screening that has been shown to significantly improve adherence to screening guidelines.
So AI can help people stay on top of their health.
Exactly. And an AI-enabled ECG algorithm for detecting low ejection fraction has actually received FDA clearance.
That's a big deal. It shows that the technology is mature enough for clinical use.
It does. And in another study using machine learning to detect Lewy body dementia from PET scans, the AI tripled the diagnostic accuracy for clinicians.
Tripled. Wow, that's a huge improvement.
It is. And there's even evidence that AI can outperform radiologists in detecting pneumonia from chest x-rays.
So AI is not just matching human performance in some cases, it's exceeding it.
That's right. And that's really exciting because we have the potential to significantly improve patient care.
Now, beyond just improving the accuracy and speed of diagnoses, it sounds like AI is also playing a major role in early disease detection.
Absolutely. Early detection is key to better outcomes, and AI is giving us new tools to identify diseases even before symptoms appear.
So it's shifting the paradigm from reactive to proactive healthcare.
Exactly. We're seeing AI-powered symptom trackers and screening devices that can flag potential health issues early on.
That's incredible. And it's also very valuable for rare diseases, which can be incredibly difficult to diagnose.
It is. And on a broader level, AI is being used to predict disease outbreaks and identify high-risk geographical areas, which can help public health officials implement targeted interventions.
So AI is not just improving individual health, it's potentially improving population health as well.
Precisely. And the long-term implications of this are really profound.
Yeah.
Early detection can dramatically alter the course of a disease and lead to significantly better outcomes.
It gives people a fighting chance.
Exactly. And with the development of more affordable and accessible AI-powered diagnostic tools, we can make early detection available to a wider population.
So it's not just about advancing technology, it's about making healthcare more equitable.
Absolutely. That's a crucial aspect of this revolution.
So earlier diagnosis ultimately translates to better treatment options and improves survival rates, right?
Absolutely. Early diagnosis allows us to intervene sooner when treatments are often more effective.
And AI can also help personalize treatment strategies.
It can by analyzing patient data AI can help identify the most effective treatment for each individual based on their unique characteristics.
That's the promise of precision medicine.
Exactly, and we're already seeing evidence of improved survival rates associated with AI-assisted early cancer detection.
That's incredibly encouraging.
It is, and when we compare AI-driven methods to traditional approaches, the advantages are clear.
Yeah.
AI can process information much faster. It can detect subtle anomalies that humans might miss,
Mm.
and it has the potential to reduce healthcare costs in the long run.
It's really a game changer.
It is, and it's important to remember that AI is not about replacing human doctors. It's about empowering them to provide even better care.
It's about collaboration.
Exactly. It's about using AI to augment human intelligence and expertise.
So this all sounds incredibly promising, but are there any challenges or considerations we need to keep in mind as we move forward with integrating AI into medical diagnostics?
Of course, with any new technology, there are always challenges and considerations.
Mm,
One area is the regulatory landscape. Regulatory bodies like the FDA need to ensure that AI-powered diagnostic tools are safe and effective.
that makes sense.
And there are also ethical considerations. We need to ensure that AI algorithms are fair and unbiased and that they don't perpetuate existing healthcare disparities.
That's crucial.
And data privacy and security are paramount. We're dealing with sensitive patient information, so we need to have robust safeguards in place.
Absolutely. Those are all very important points. And what about the limitations of AI? Are there any areas where it falls short?
Well, AI is still in its early stages of development, and there are areas where it needs to improve. For example, AI can sometimes struggle with complex or unusual cases that fall outside of its training data.
So it's not a magic bullet.
It's a powerful tool, but it's not a replacement for human judgment and expertise.
And there's also the issue of interpretability. Sometimes it's difficult to understand how AI algorithms arrive at their conclusions.
That's true, and it's an active area of research.
Mm.
Developing more transparent and explainable AI systems is essential for building trust and ensuring responsible use.
And what about the future of AI in medical diagnostics? Where do you see this field heading?
Well, I think we're just scratching the surface of what's possible. I expect to see even more sophisticated AI algorithms that can analyze multiple types of data, including imaging, genetics, and electronic health records.
So a more holistic view of the patient.
Exactly, and I think we'll see AI playing an even greater role in personalized medicine, helping doctors tailor treatments to each individual patient.
And what about the role of patients in this evolution? Do you think patients will become more actively involved in their own healthcare with the help of AI?
I definitely think so. We're already seeing AI-powered apps and devices that can help patients track their health and make informed decisions.
So empowering patients.
Exactly. And I think that trend will only continue as AI becomes more integrated into our lives.
Well, this has been an incredibly insightful conversation. It's clear that AI has the potential to revolutionize medical diagnostics and improve healthcare for everyone.
I agree. It's an exciting time to be working in this field.
So to wrap things up, let me just reiterate some of the key takeaways from our discussion today. AI is enhancing the accuracy and speed of medical diagnoses. It's enabling earlier detection of diseases, and it's paving the way for more personalized and effective treatments.
And we need to be mindful of the challenges and considerations, but overall, the potential benefits are enormous.
Absolutely. So for those of you listening, I encourage you to think about the implications of this shift towards AI-powered healthcare. How might it change the way we think about health and disease in the future?
And what role do you want to play in this evolution?
What questions has this deep dive raised for you?
Thank you for joining us on this fascinating journey.
And we look forward to exploring more frontiers of AI with you in future episodes.